Support for this podcast comes from the Central Valley Journalism Collaborative, connecting communities with the resources, infrastructure, and networks to ensure a vibrant local free press.
From KVPR in Fresno, this is Central Valley Daily. Happy Friday, it's March 7th. I'm Elizabeth Arkalian. Right now, members of Congress are working on a new federal budget, and they're proposing significant tax cuts.
What the Congressional Budget Office has found is that there is no way to do these cuts without getting into Medicaid.
Coming up, we'll learn more about Medicaid and how cuts to it could have major impacts here in the Central Valley. But first, these news headlines. Fresno Congressman Jim Costa has explained why he was among a small share of Democrats to break away from their party this week. Costa voted to censure a fellow Democrat who heckled President Donald Trump during his joint address to Congress earlier this week. Representative Al Green of Texas was protesting cuts to Medicaid. More than 200 members of Congress then voted to censure Green, but only 10 were Democrats. In a statement, Costa said he agrees with Green that Trump does not have a mandate to cut some federal programs. However, he says he disagrees with disruptions during congressional proceedings. And back here in California, Democratic Governor Gavin Newsom says he is not in favor of allowing trans women and girls to compete in female sports. He says he views the practice as unfair. The statement represents a break from the Democratic Party. Newsom made the comment in the inaugural episode of his new podcast, This is Gavin Newsom. His first guest was conservative activist Charlie Kirk. Newsom is seen as a potential candidate for president in 2028. Keeping backyard chickens could bring down how much you pay for eggs, but it won't address the underlying cause of soaring egg prices. That's bird flu. As KVPR's Carrie Klein reports, many in the state legislature heard this message on Wednesday.
The statement came from Bill Mattis. He's president of the California Poultry Federation. He was among many speakers discussing bird flu with two state Senate committees in Sacramento.
We oppose it. We oppose any chickens in a backyard just because of the bird flu and what it can spread.
He was responding to comments made by Ag Secretary Brooke Rollins on Fox and Friends. Rollins encouraged keeping backyard chickens. But health officials warned the most severe human cases of the virus occurred after people handled backyard chickens, including one patient who died in Louisiana. State data also showed the most recent wave of the virus has been especially deadly to poultry. But there's a silver lining. New cases have slowed down among people and cattle. For KVPR News, I'm Carrie Klein.
4 candidates are looking to become the next president at Fresno City College. As KVPR's Rachel Livenall reports, an anonymous letter was issued to them on Thursday morning. It claimed to have come from current and former college employees.
The letter was emailed to all candidates and posted online by an anonymous group called the SCCCD Insiders. That stands for State Center Community College District. The group has published a series of blog posts online going back months that levy accusations against district leaders. KVPR learned that the group comprises faculty, staff, administrators, and members of the public. The group, in its letter, asked candidates for Fresno City College president to read all of their articles. The blog posts point to turmoil in some corners of the college district. The writers also say in their letter they plan to closely monitor and scrutinize the future college president. KVPR confirmed the letter reached at least one candidate. For KVPR News, I'm Rachel Livenall.
The city of Clovis has chosen a new district map that will be used in future city council elections. The city recently changed to district voting after the threat of a voting rights lawsuit. Council members will now hail from 5 districts. Before the change, council members could run for office regardless of where they lived in the city. Supporters say this offers better representation at City Hall. The map will officially be adopted on Monday and be used in the 2026 elections.
Looking for a way to support KVPR but can't write that big check at the moment? What about that old unwanted car in the driveway? Your vehicle donation could net hundreds of dollars for KVPR. It's easy. We'll tow it away free of charge, KVPR gets a check, and you'll get a receipt for your taxes. And we can take RVs, boats, and motorcycles too. Find out more at kvpr.org/cars or call 855-277-2346.
And now to our main story. Among the budgetary cuts being floated in the federal government right now, perhaps the most controversial proposal is cuts to Medicaid, the government-funded healthcare program. On Thursday, the nonpartisan Congressional Budget Office released a report saying the cuts were necessary under the spending plan being pushed by Republicans. But the idea is controversial and has created confusion. Even Republicans are split on the issue. Many of their constituents are enrolled in Medicaid in high numbers. A recent New York Times analysis listed the Valley House District, represented by Hanford Republican David Valadao, as having the highest rate of Medicaid enrollment compared to any other U.S. congressional district. 68% of Valadao's district is enrolled in Medicaid. President Donald Trump, meanwhile, has said Medicaid is safe, though House Speaker Mike Johnson says the cuts are necessary to root out fraud and waste. Because of these discussions, we want to take a closer look at how this issue affects our region. The San Joaquin Valley has some of the poorest health outcomes in the state and one of the highest enrollment rates in Medicaid. To discuss this further, we invited Tania Pacheco-Werner to the KVPR studios. She's the executive director of the Central Valley Health Policy Institute at Fresno State. Tania starts us off by explaining what Medicaid is.
So Medicaid is a joint federal and state program that provides health coverage to specifically those low-income adults, children, pregnant women, elderly adults, and people with disabilities. So there is eligibility criteria around that, but those are the populations that it serves. So as you can imagine, this program has been around for decades alongside and since the mid-1960s, and it was part of the Social Security amendments when that came into play at the federal level. However, Medicaid is set up so that each state really administers its own program, how they see fit, as long as it falls within certain federal guidelines.
And Medi-Cal is essentially California's version of Medicaid, right?
California's Medicaid program is known as Medi-Cal. So if you live in California and you say, I have Medi-Cal, it really is part of this federally joint funded program.
Okay, so essentially Americans' taxes go towards funding medical coverage for people with low incomes, people who might not be able to afford private insurance and might not be insured through work, essentially.
Exactly. And it's important to note that many people can fall under that, even if they are in a family where there is private insurance around. So, for example, a person can have insurance through their employer. However, their wages are so low that they might actually cover their children, for example, or they might only be able to qualify for insurance for themselves. So maybe the mother in the family may need to rely on Medicaid during their pregnancy. So it is important to think about this as not just a very small percentage of people, but in California, we're really talking about almost 1 in 3 residents might have access to Medicaid because they qualify.
So it's really filling the gaps in certain areas as well. I mean, to your point, there's data from the California Healthcare Foundation that finds Merced, Madera, Tulare, and Kern counties all have more than 50% of their population enrolled in Medi-Cal. So with that context, can you speak to how major Medicaid cuts could directly impact us here in the Central Valley?
Well, we in the Central Valley counties actually have some of the highest Medi-Cal enrollments rates in California to begin with. So when I say that 1 in 3 residents, that really it comes down to about 1 in 2 residents when it comes to the Central Valley specifically. Now, when it comes to rural counties like Mariposa and Madera, this problem becomes even more heightened because they have such limited healthcare infrastructure. So really relying much more on those healthcare facilities that rely on Medicaid funding to be able to keep the lights on.
And can you give us more details about those proposed cuts for Medicaid that Congress is considering right now?
Yeah, so the current resolution for our budget proposal says that we have to cut a particular amount in our budget. And what the Congressional Budget Office has found is that there is no way to do these cuts without getting into Medicaid. And even if you just block out Medicare and protect that completely, there will be those Medicaid cuts. There is no way around that, according to the Congressional Budget Office. And when we're talking about numbers in the nation, we're talking about $880 billion in Medicaid cuts. So these are needed cuts in order to fund the tax cuts that are proposed in the current congressional spending bill. When we think about how those things will get translated into when I walk into my local healthcare facility and need an appointment, is that there will be less funding to expand services. There will be less funding to keep the already strained providers that are here. So we will engage in longer wait times to receive basic care, which we know is really essential for places like the Central Valley, where we have challenges like high diabetes rates, high asthma rates, where you really do need access to consistent medical care in order for those things to not lead to worse outcomes that, again, become more costly. So as those safety net hospitals bear the brunt of this more expensive care, they will have less money in their budgets to be able to pay for physicians, pay for lab work, and that'll lead to longer wait times.
And when you add in the aspect of having a doctor shortage here in our area that's more rural, I mean, you can just imagine how complicated that would be for an everyday person seeking treatment. You know, I think it's worth explaining that part of the way that the federal government pays for Medicaid is by reimbursing hospitals and facilities for the Medicaid patients they treat. Now, that reimbursement is well known to be low compared to the reimbursement from private insurers. And those low Medicaid reimbursement rates have been partially blamed for the closure of Madera Community Hospital and slim profit margins at other facilities as well locally. So is it possible that these cuts could further endanger some of these local hospitals that are kind of already in a precarious position?
Absolutely. Those safety net hospitals bear the biggest brunt of these proposed cuts because they live on the margins in terms of not just the main providers that you see, like the doctors, but the nurses, the lab technicians, everybody that it really takes to keep the lights on and keep a hospital functioning. And when those things diminish, when hospitals have less funding and they were already teetering on the edge, then places like the Central Valley become more vulnerable. However, it is also important to note that because it's not just doctors or nurses, there are a lot of healthcare jobs tied to this sector that relies on Medicaid funding. And so in our counties, in the Central Valley counties, that accounts for about 15 to 20% of healthcare jobs. And so we are talking about a significant portion of our local economy potentially being impacted by these Medicaid cuts, aside from the patient side. So we always think, are these problems just for those who are most vulnerable, already living in poverty? No, they could be for your neighbor who has a mortgage and relies on working in one of these safety net hospitals day to day.
Tania Pacheco-Werner, Executive Director at the Central Valley Health Policy Institute. Thanks for joining me.
Thank you.
And that does it for today's show. Don't forget to rate and review the podcast if you haven't already. We really appreciate it. Today's episode was produced by Jonathan Linden and KVPR with support from the Central Valley Journalism Collaborative. I'm Elizabeth Arkalian. Find the latest local news anytime at kvpr.org.
Each morning, it's a new opportunity, a chance to start fresh. Up First from NPR makes each morning an opportunity to learn and to understand. Choose to join the world every morning with Up First, a podcast that hands you everything going on across the globe and down the street, all in 15 minutes or less. Start your day informed and anew with Up First by subscribing wherever you get your podcasts.